We're very excited to start our new oncology collaboration program. What we are trying to do is have these multidisciplinary tumor conferences where we have physicians, medical oncologists, radiation oncologists, surgeons, social workers, and other resources for patients. And we try to sit down together and discuss each case in detail, getting opinions from multiple physicians in the same field and multiple physicians from all these different fields to have a very comprehensive approach for cancer care for all of our patients.
The premise of Tumor Board is really that two heads thinking about a problem is better than one. And what we find in Tumor Board is that oftentimes, because we have a multidisciplinary team and doctors from every area of oncology, that people will bring up other things that maybe a certain specialist was not thinking about, and it helps us all to become better and to come up with a plan that suits that patient best.
One of the major benefits in this one visit, they quickly get a really good assessment of what their situation is and what their options are.
Our goal is to increase survival. I mean, that is the bottom line. And part of that has to do with expediting diagnosis and implementing treatment right away. And that's another huge benefit of our situation here, because it is not unusual for a patient to hit the door and be starting their treatment by the end of the week, because we can do everything that needs to be done right away. The classic tumor board patient is one where there's somewhat of a diagnostic dilemma about how to go forward. And I think it's a very powerful thing to go back to a patient and say, you know what, everybody in the room, we've got all the experts together, and we've discussed all of our knowledge base of the studies, our personal experience, and we've pooled our knowledge, and we all have come up with a plan for you. One other thing that we've done here is we tried to create really cohesive treatment pathways for the various cancer types so that it's very clear that once a patient has a diagnosis, their options are very clearly explained to them, and that we have these treatment pathways set in place from before that patient ever hits the door, so there's never any uncertainty about what's available and the pros and cons of every approach. And I think that as a patient, to know that everybody got together, they're all in the same room. I think far too often patients, when they're in a cancer situation, they go from appointment to appointment and second opinions and this and that, and I think it's very easy for that treatment pathway to become very fractured and disjointed, and that doesn't help the patient at all, because they're scared and they're sick and they have to make these very serious decisions. I think there's something truly unique about getting all these specialists together, and I think that's really reassuring for patients.